Welcome to the latest edition of Optima YouTube Live. Today, we'll be discussing about neck pain. We have with us Dr. Kushbu, who is a consultant physiotherapist here at Optima Hospital. So, welcome, Dr. Kushbu.
Thank you, sir.
Um, First of all, before we start discussing, I just wanted to mention that few things about neck pain. So, neck pain is something that is very frequent in the sense that a significant percentage of the population seems to suffer from neck pain at some point or the other. In fact, some research studies have shown that when they've gone out and asked people that, do you have neck pain or do you not have neck pain like that, around 30% of people have told that they have neck pain. So, 1 in 3 people seem to suffer from neck pain, and many times the neck pain is something which becomes chronic. Chronic is where we have the neck pain for a very long time, and that is defined as a neck pain which goes on for more than 6 weeks or 3 months, and that it usually occurs in 30% of patients who have neck pain. So, among the people who have neck pain, 1 in 3 again will go on to have a neck pain for a very long time. I also, though I'm a rheumatologist, most of the patients with neck pain either go to the general physician or to the orthopedician or sometimes even to the neurologist. And of course, physiotherapists must be getting a lot of people with neck pain.
Yes.
Uh, I also get some patients with neck pain many times, and most of the times they are very, very worried. At least the patients that I get, they're very concerned. They're worried that they're having some major or serious problem. So I was just wondering what all people think of when they think of that they have neck pain. So, Dr. Kushbu, what has been your experience when people come in with neck pain? Are they do you also see patients being very, very worried or very anxious? And if so, what are they generally anxious about or worried about?
Yes, sir, definitely. So, whatever the patients I have seen, as of now, most of the patients they do have the pain from the more than 3 months, and they have a lot of different reasons, and they are always worried about like how long it will take to get rid of the neck pain and how long they have to do the exercise. So, yeah, so many questions they do have regarding the neck pain.
So that is very interesting that patients who come to you are mainly worried about how long they have to do the exercises.
Exercises.
But patients who come to me with neck pain, they are usually more worried that they have some serious disease which is going to harm their bones or harm them in some way. And I can from a non-medical person, a lay person's perspective, I can understand how they can be concerned. In fact, one of my friends, when I was in medical college, postgraduate medical college, when I was doing my post graduation, one of my friends developed neck pain, and it ended up to be tuberculosis. So she had tuberculosis in one of the bones.
Yeah.
So neck pain can sometimes be a sign which can mean that a patient can have tuberculosis. Sometimes patients with much more serious problems like bone fractures or even sometimes some types of cancers can cause neck pain. Sometimes heart attacks, which are usually present with chest pain, but in some situations, especially many times, not especially, many times in women, it can present as neck pain as well. So, even in rheumatology, we have certain disorders like ankylosing spondylitis and Takayasu's disease. Takayasu's disease causes neck pain in the front where our blood vessels are there. So, ankylosing spondylitis is a problem of the spine. So, those patients can again have a severe neck pain. However, all of these conditions are very, very rare. So, it is very unlikely that a person with neck pain will have this problem. Neck pain, as I told in the beginning, is a very frequent problem. It occurs in up to 30% of the population. And 30% of the population doesn't have all of these diseases. These diseases are rare diseases, right? So it is very infrequent that a person with neck pain will have a serious problem. So first of all, at least based on my perspective, the patient kind of patients I have seen, I want to reassure if anybody is out there who's having neck pain and thinks that they might have some serious problem. The statistics are in your favor because it is very unlikely that you have some serious cause of neck pain. It's most likely what we, at least rheumatologists, term it as mechanical cause. So it has to do with the biomechanics. What we term, there is a terminology called biomechanics, meaning how our bones and muscles and ligaments and all move in relation to each other. And of course, physiotherapists are very good in that. So most of the time, we end up sending patients with neck pain to the physiotherapist. So, what are the common causes of neck pain that you see in your practice, Dr. Kushbu?
Yes, sir. So the most of the time, it's like more related to the age who is above the 30 years. Or I have seen a lot of time the women's are having the more neck pain compared to the men, and lot of like of occupational related like a desk job people and who sits poor posture, like more of the slouching of the posture, forward head postures. So terms of that also creates a lot of time tightness in the muscles, and because of that they do have the problem in a neck. Along with that, there are some others like a muscle strain. So that means like repetitive movements of the neck where you have to where you are engaged with the more of the sports related any activities, or like something which where you have to work more of the labor job or the manual labor is more, and that is the case where the muscle strain increases more, and some of the cases where the awkward and the sudden movements they do, so that also one of the reason where the muscle goes to the sprain or the strain position. So these are the mainly factor which I feel I have seen in a mechanical terms like a muscle strain, forward head postures, weakness of the muscles, and tightness of the few of the muscles. So this is my
That
point
is
that postural wise, uh, more of the creating a problem towards the neck pain.
okay. So that's very relevant. As I was saying previously, also that serious causes of neck pain, like some disease, are very rare, and the most common cause of neck pain is usually a muscle sprain. And that muscle sprain, as Dr. Kushbu was just highlighting right now, can be contributed by various movements as well as repetitive movements and as well as weakness of muscles uh, and jerky movements as well. When you say repetitive movements in sports, is it like, for example, I play badminton once a week, right? So, is there? So, can I be predisposed to neck pain? As an amateur sports player.
No, no, sir. So that's the point that how you are strengthening your muscles, how the warm up and cool down is going before and after your sports. So that's really important that you do bit of warm up for the neck exercises, so that can maintain your good posture while playing and also.
Oh, that's a very important point. I think that is something even I should implement. Many times we just start off playing and then we stop playing. So, but that sudden start to movement can cause problems in our
Problem.
muscles. Very relevant point. So, always we need to do a warm up. And in fact, after we finish playing, we need to do a cool down as well. So those are quite relevant points, and I think that is something that even I try to implement henceforth. Uh, uh, so muscle sprain is one of the most common causes of neck pain. Many times, I have patients who have MRIs in which there is some disc herniation and all, and they are very, very concerned about that disc herniation. So, is disc herniation a common cause of neck pain in your practice?
Yes, sir. Yeah. So acute disc injuries, disc bulge with the pain radiating on bilateral arms. So that is all like how the degenerative changes has happened, or wear and tear of the between your joint and the disc. So that could be the all reason that what extent of injury of the disc it is, and that is we normally known as a spondylosis, radiculopathy. So that can be also one of the major sign of a neck pain.
Okay. So if a patient has radiculopathy versus a patient who might have a muscle sprain, will there be any difference with respect to the kind of pain they experience or with respect to the kind of treatment that they get?
Yes, sir. So the muscle strain generally will be like it will reduce within 2 to 3 weeks of a time if it's just the acute. So the pain also what you experience will be the different intensity of pain will be lesser in the muscle strain compared to the radiculopathy, where the disc bulge, acute disc bulge, you have the severe pain which restricts your movement as well, and it will create a lot of tingling, numbness around your arm. So that could be like a major differential in between the spondylosis, radiculopathy, and the muscle sprain.
Okay, so that's a very easy and interesting way and a simple way that people can, really tell whether, because the problem with MRI is that it is an oversensitive investigation. This is something that I repeat very commonly to patients because many patients get MRI done and then MRI is oversensitive, meaning it picks up things which might not be relevant. So many times, if we do an MRI in patients who do not have any back pain, also, they're also in up to 40 to 60, 40 to 45% of patients, you will see disc herniation over there. So this is MRI done in normal people, meaning people without any back pain at all. Even in those people, 40% of people, you will see disc herniation. So MRI is an oversensitive investigation, and many times it will pick up things which might not be relevant. So really not something that people need to get very worried about. A very simple way, as Dr. Kushbu just pointed out, a very simple way to tell whether the disc herniation on the MRI is relevant to you or not is whether you are having tingling sensation or not. If you are having tingling sensation, then it's likely that you have spondylosis or radiculopathy that is related to the disc that you're seeing in the MRI. If you don't have tingling sensation, it's more likely to be a muscle sprain. So, have I understood correctly, Dr. Kushbu? That is what
Yes, sir.
you said, right?
Yes, yeah, exactly. So yeah,
Okay.
in radiculopathy, generally you can make out that pain is radiating down to the arm, which is giving you the tingling, numbness, sort of the feeling. And muscle sprain, which is like more of likely to having a pain surrounding the neck, surrounding the muscles of the uh, upper back. So you can differentiate easily that. But so many times, yeah, if the muscle sprain also, if you have in a severe, so in that case, we have to do the few assessment tests where we can rule out and differentiate whether the this falls under the radiculopathy or
Of
muscle
course, of
strain.
course.
Yeah.
So, but a rough rule of thumb. So it's not perfect. So a rough rule of thumb for everybody who's listening on the YouTube live. For the rough rule of thumb is that if there is, it's not a perfect rule, but if there is tingling sensation, it's more likely to be due to the disc that you're seeing on the MRI. But and if there is no tingling, then it's more likely to be a muscle sprain or a muscle injury. And for everybody who's watching right now, of course, thank you for logging in, and I hope this is useful information and helps you. Please, if you have any doubts or if you have any comments, either during the broadcast or even afterwards, if you're watching this video afterwards, please put your doubts or comments in the comments below yeah, below in the YouTube video, and we will try to answer all of them. So, Dr. Kushbu, what is the common things that lead to these kind of muscle injuries causing pain in in people, like frequently in your experience?
Yes, sir. So yeah, most of the time, as I told, it's more of the posture related, like how you sit, like how the muscle tightness, whether more of the time slouching, forwarded posture. So this is the one of the main reason of the posture, how you are maintaining.
I
Again,
think you
second,
have a picture. Shall I put that picture
yes,
up?
sir, yes, sir. Yes, sir. So as you can see, everyone, that while using the screen, what kind of the posture you have to follow. So the as a slouching posture, forwarded posture, that is a wrong. So what could be the perfect posture to sit is like always your monitor has to be on eye level. You have to sit one hand distance from the monitor, and your elbow and the wrist you have to keep it at 90 degree of the position. Always sit on the chair where you have the lumbar support, an adjustable chair. Also you can always have to check is the armrest, because that is also one of the major important thing, that how you are keeping your arm for the longer period of time. So this is the posture that you can follow for the good posture
Okay,
criteria.
so just so that even I remember, I think you mentioned four things, right? So can we
Yes,
just
yeah,
enumerate them? One is that the monitor should be at eye level,
at the
right?
eye
This is
level.
one point, right?
Correct, sir.
Then what is the second point?
Second is your monitor has to be one arm distance from the chair.
So there
From
should
the,
be,
yeah, you
okay, so from the monitor to the
you have
chair,
to sit, yeah, one arm distance.
one arm distance. So from the shoulder to the tip of your
Yes,
finger. So that
yes,
should
sir.
be from here to here should be from the shoulder to the tip of your finger. Is that correct?
Yes, correct, sir.
Okay.
Yeah.
And then what is the third thing?
The lumbar support of the chair. So the chair has to be support on the lumbar region.
So this area that is lower of our back should be supported. It should not be like over here. It should be supported by the chair. Correct? That is the
Yes,
third
sir.
thing. And then the fourth thing.
Arm resting. You have to keep your arm on the resting area.
So yeah, so remember to keep the arm on the armrest. So the monitor at the eye level, the distance of the monitor being around one arm length, the arm on the armrest, and lumbar support. So those 4 points we all need to remember when we are working at the desk on our system. Uh, have I enumerated them appropriately, Dr. Kushbu?
Yes, sir. Yeah. Perfect. Yes, sir.
So, what are the apart from being on a desk job and not maintaining a proper posture? What are the other things which can
So
predispose
sedentary
people?
lifestyle, yeah. So the sedentary lifestyle where you're physically your leg activity is very less, and that can also lead your muscle to tightness and the weakness of the muscles. So that is again one of the major important thing.
So, it is important for us to make sure
Be
that we
active.
exercise regularly and we are active. Okay. So, when you say that we have to be active, is it what do you mean exactly? Because what I've understood is many people have different uh, sort of ideas about what an active lifestyle means. And so when you say that you should not be sedentary, you should be active, what is it that you're trying to convey to people or patients?
So yes, sir. It's generally basic exercise, basic mobility, and normal your walking, warm up and cool down. So these are the basic stretches. If you do at least weekly, 3 to 5 days, which is like a moderate intensity of the exercise, so that would be not come under the uh, sedentary life. So it
Correct. So moderate level, we should not do some exercise which is easy. We have to do at least moderate level. So something which tires us out or something which uh, causes a little bit of, let's say, discomfort to us. Moderate level of exercise for at least 30 minutes. Am I right? At least 3 to 5 days
30
a week.
to 45 minutes. Yeah,
30
30
to
to
45.
45 minutes in a 3 to 5 days of week.
3 to 5 days of a week. So people say that I'm very active at work and I'm very active in the house. So would that count as activity or exercise?
No, sir. So I would say, yeah, extra you have to do basic exercise, just normal walking of the few days. So that can be counting as in a part of active lifestyle. but doing the normal work and all, it won't be considering as an
Yeah, I agree. I agree. So that is something that we need to inform to the general public as well as to patients many times that however active you are in your work or at home, that will not be counted as exercise. You have to do moderate level of exercise, at least 30 to 45 minutes per day, 3 to 5 days a week to make sure that you fall into the active lifestyle category. So Shushma is asking that, what is the role that pillows can play with respect to neck pain? So can pillows cause neck pain? If so, then what are the kind of pillows which can not cause neck pain? And can pillows help with respect to relieving neck pain? So would you like to answer that question, Dr. Kushbu?
yes, sir. Yeah, so yes, Sushma, it does affect the pillow size, the stiffness of the pillow. If you are using too high of the pillow size, and if it's very really stiff, it doesn't maintain your normal curve of the spine. So definitely that you have to, if you have the morning stiffness, if you when you wake up and if you have a pain, so in that time, if such a situation, in that case you have to do the use the pillow which comes like ergonomic neck pillows which you can use for it. It maintains your normal curve.
So basically, pillows which maintain the normal curve of our neck. That is, our neck is curved like this, sort of, right? So
Yes.
the ones that maintain the normal neck and don't push our neck like that, right? So those are the kind of pillows which we should use. Roughly, if we put it like that, would that be correct?
Yes, sir.
Okay.
Yes, sir.
So
Yeah.
I think that answers Asha. Asha has asked a question saying that can sleep position cause neck pain? So of course, sleep position can also cause neck pain based on the fact that how you're keeping your neck. If you're keeping your neck in a flexed position, which is contrary to the normal position of the cervical spine or the neck, then you can have neck pain. That is possible. Shivraj is asking, can neck pain cause headache? So the answer to that is yes, Shivraj. Neck pain can cause headache many times. So especially there is a particular kind of condition which is called myofascial pain syndrome. And myofascial pain syndrome, many times people have sort of spasm in the muscles, which can appear like knots. So when you feel, you can feel as if there is some swelling over there and some knot. And when people have myofascial trigger points, let's say higher up, maybe over here, then they can have neck that because of that pain, they can have headache as well. So this is a common problem that can occur in people who have neck pain. Uh, 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 Sorry, who have myofascial pain, that they can have neck pain also, and the same neck pain can cause headache as well. So, Shivraj, I hope that your question has been answered. Um, uh, Charita asks, what are the main problem of neck pain? So the main problem that is with neck pain is basically discomfort, restriction of quality of, like you're not able to do certain activities if you have neck pain, and therefore it causes a lot of discomfort and as well as reduces your quality of life. So that is one of the main things, main problems that you can have with neck pain. Otherwise, as we mentioned in the beginning of the video, neck pain is unlikely to be due to serious diseases. So neck pain will never cause paralysis or or due to some other serious condition or anything like that. So that is very very rare. The main problem associated with neck pain is the discomfort that you experience as well as the reduction in the quality of life because you're not able to do many things. You're having neck pain, so you're at home. You're not going around going out to meet your friends or family or whatever it is. So I think that also answers Chitra Yadav's question that how does neck pain affect daily life? There are many things what we call as functional limitation. So there are many functional limitations which can occur due to neck pain. I think Dr. Kushbu is an expert on that. So what are all, like, if you have neck pain and if you have restriction in the movement of the neck, that you cannot move the neck properly, how can it affect your daily life, Dr. Kushbu?
Yeah, of course. So your neck pain can restrict your movement. So you won't be able to perform your work very comfortably. You will be having sometimes, as sir answered, the headache and the radiating pain on the arms. Sitting for the longer period of time will be the difficulty. Even so many times when you wake up in the morning and you have lot of stiffness, not able to move. So these are the things which can impact on daily life activities.
Yeah, and there are certain activities, for example, just reversing. So reversing a car is something that you're like, just to give an example, you need to use your neck. You need to be able to move behind and have a look many times when you're reversing. So that is something which becomes problematic if you're having severe neck pain and your movement of your neck is limited. So as we were discussing in the beginning of the YouTube live as well, that mm, most of the causes of neck pain is usually due to a muscle strain. And then, of course, sometimes you can also have neck pain due to disc herniation, where you can have something called as radiculopathy. So, with respect to the treatment of the muscle strain, exercises, there are medications which can be used for reducing the inflammation in the muscle, as well as trying to reduce the irritability of the nerve. But primarily, of course, exercise becomes very important with respect to treatment of neck pain. So, for prevention of neck pain, Dr. Kushbu mentioned about posture, and but for treatment of neck pain, exercises is something that we need to focus on. Before we go on to that, I'll ask Dr. Kushbu to tell us about the exercises, and she's prepared some videos also, which she will show. Niranjan is asking, when do you need to worry about neck pain? So that's a very good question, Niranjan, and in fact, that is something that I should have touched upon. So that we have a list of certain things that are called red flags. So if you have a red flag, that is when you need to worry about your neck pain. So what does a red flag mean? So if you're losing weight, okay, if you had previously been diagnosed with cancer, if you're on steroids, if your neck pain is preventing you from sleeping, that is, the pain is worse at night. If you have fever along with your neck pain, if your neck pain is causing reduction in strength or reduced sensation, you are having weakness of the feet muscles or the hand muscles, or you're not able to feel in the feet or the hands, even when you touch, you're not able to feel. So these are some of the red flag signs. And if you have any of these red flag signs, that is when you need to worry about the neck pain. Otherwise, most of the times, neck pain do not require any major tests or investigations. Mainly, the treatment of neck pain is focused on exercises. So, coming back to that, Dr. Kushbu, would you want to tell about the common and important exercises which are required in the treatment of neck pain?
Yes, sir. So I would like to show you all of you the very basic stretches and the movement exercise which you can perform every day, or any sort of neck pain you have, you can do this. So, sir, can you please video
Yeah, the first video you should be
first
able to
video?
see.
Yeah,
Yeah.
yes. Sir. So here is like lying on the straight position. Keep the towel under your neck. And this is called neck flexion. So what you're gonna do here is just extend your neck and then get it back, chin tuck inside, hold it for a three count, 1, 2, 3, and then let it go slowly. So this is the first exercise which you can perform 10 to 12 times, one set of exercise.
Okay.
Yes, sir. Can I have the second video?
Yes.
So yeah, here is the exercise name is the 4 point chin tucks. So you have to be in a 4 point, which means your hands will be under the shoulder, your knees will be under the hip. Stay in the same position. Yeah. and chin tuck inside, backside. So that means your face will be straight when you do chin tuck. Retract back, hold it for the 3 count, and let it go slowly. Yes, sir, you can.
Sorry for some reason. Yeah. So that's the chin tuck, right?
Yes, sir. This is the chin tuck. Yes, sir. So here is the third exercise, which is thoracic extension. So you have to lie down on the straight surface, keeping, you can use your pillow, or if you have the roller, you can keep the foam roller on your mid back area. Both the hands you have to support the neck and just extend your back as much as possible.
Do I replay that?
Yes, sir. Yes, sir. Once you replay. Yeah, so extend it down as much as you can and get it back, sit up, again do the same thing. So this is also you can do 10 to 12 times, one set of exercise. Yes, sir. Yeah. Yes, sir. Can I have the fourth?
The fifth one. Yeah. Fourth. The fourth. Okay, the fifth one is there. Fourth one is missing.
Yeah, there will be page turner.
No, page turner is video is not there for some reason.
Okay, sir.
We'll
Yeah.
have to mention that later. Yeah.
Yeah.
So we have the fifth video, which is the
Yeah.
lat
So the
stretch,
fifth,
right?
it's a leg stretch where you can use the chair or the bedside of the height. You can be on a kneeling position. Keep the both the elbows at the edge of the chair. Go down. Get your both the shoulder blade together. Squeeze it nicely. Feel the stretch around your upper back region. Stay for the 3 to 5 counts and come back. So this also you can do 8 to 10 times. Yes, sir. So here I have the last exercise is a neck side stretch. So this is to improve the flexibility of the muscles. Sit on the chair or the any of the bedside of the table. You can keep your one hand down. So that means shoulder will be depressed. And with the help of the other hand, you have to just do the side stretch, hold it for the 10 counts and leave it. So this you can do 3 to 5 times. Yeah, just hold the stretch for the 10 to 20 counts and get back to the normal position. This you can do 3 to 5 times. Yes, sir.
So that was very interesting. Thank you, Dr. Pushpu, for demonstrating all of those exercises. So as Dr. Pushpu showed, many of these exercises are something that we can all do even when we are busy at work or somewhere else. So with these exercises, how frequently are we supposed to do these exercises? What would you suggest, Dr. Pushpu?
Yes, sir. So as I told, 3 to 5 days a week you can perform these exercises. If you are suffering from the neck pain, which you have like more than the 3 months or the chronic pain, you can do twice a day also. But otherwise, doing a once a day for 3 to 5 days can maintain your good flexibility and the movement. Uh, so there's many times you can follow the exercise.
So we have discussed about how frequent neck pain is, that it occurs in a lot of people in the general public. However, we have also discussed that among people with neck pain, many of them can have chronic, meaning neck pain which lasts for a very long time. 30% of patients, that is 1 out of 3 people with neck pain, will have chronic neck. Cause of neck pain like TB infection or things like that are very rare, and we discussed which tells us whether you are likely to have these rare serious causes of neck pain. Otherwise, the large majority of neck pain are what we call as non-serious or non or mechanical causes of neck pain. where they cause a lot of pain and discomfort, and they reduce the quality of our life, but they're not something that we need to worry about, from medical sort of perspective. So biomechanical neck pain, as Dr. Kushbu pointed out, most commonly is due to muscle sprain or muscle injury that usually occurs when we do sudden jerky movements, and therefore when we are playing sports or anything like that, we need to always do a warm up before we do play the sports, and also to do a cool down stretching exercise after we have finished playing the sport. So that is important. In addition to that, maintaining proper posture. Dr. Kushbu told us how we're supposed to sit when we are at work. The four things that the monitor should be at eye level. It should be one arm distance from us. The arm should be resting on the chair, and the lumbar support, that is the lower back, should be supported. So these four things you need to remember when you are sitting, to make sure that you have a proper positioning, ergonomic positioning, and that will help prevent neck pain, back pain, and other problems. In addition to that, in case you develop neck pain, most of the time no major tests are required. You just need to start off on exercises. Exercise is a very important part of treatment of neck pain. And Dr. Kushbu showed us the exercises. They will be there on YouTube, and we'll probably be posting them individually again on YouTube Shorts as well. So please go ahead and use those exercises if you're having any issues with respect to neck pain. Of course, it's always a good idea. Does not represent uh, uh, sort of, instead of consultation, you can just see this video. That is not what we are trying to convey. It is just an additional aid to many people. And if you are having neck pain, you should always, of course, consult a medical health professional. Most of the times, you will need the help of a physiotherapist to take care of your neck pain. So that is the message that I wanted people to know. Have I covered everything? Anything else, Dr. Kushbu, that I've left out while summarizing the YouTube live that we had today?
No, sir. I agree that the tips what you gave, that maintaining the good postures and following the ergonomic tips, doing the regular exercise. And I would like to say, if you are continuously working for more than 8 hours, take a break in between, like every 30 minutes, 40 minutes, just move around, do the basic stretch. So that way also you can maintain your muscle properties, like to creating more stiffness and be hydrated. So that is also one of the reasons where the muscle goes to the stiffness. So the dehydration can cause the muscle stiffness more. So hydrating also is a really important part. So yeah, sir, you covered almost.
Okay, perfect, perfect.
Yes, sir.
So we've already crossed beyond the time limit, but I think there are no other questions. So if there are no other questions, then I think we have uh, covered most of the topics that we wanted to convey to the general public. Thank you everyone who attended the Optima YouTube live today. So we'll continue to have these monthly live sessions, and we'll be discussing general health topics. Please mention in the comments what is the kind of topic that you would want for next month, that is for July 15th. So we have these YouTube live sessions usually in the evening on the 15th of every month. So for 15th July, what is the topic that you would want to be discussed? Please mention that in the comments, and we'll try to see whether we can have that as a topic for 15th July. So thank you, Dr. Kushbu, for attending the
Thank you.
session today, discussing about neck pain, showing patients what are the exercises that need to be done, and also mentioning what are the points that you need to be careful of when you want to be careful. What are the points with respect to your posture that you need to be careful of if you want to avoid neck pain and back pain? Thank you so much.
Thank you, sir. Thank you.
Thank you everyone who have attended, and see you